to identify blood cells in the smear. How to draw a blood smear has already been done. Those who are new, so many people raised your hands. Those who have not attended this class, you have to do it now today itself. Learn today itself and proceed. Because in what I go on repeating throughout the year, after 9 months you see how short is the time. Okay. So most things can't be repeated. So there will be some revision classes, and you will have to cope up. So what we will have to do is identification after drawing the blood smear and staining it. Staining is with the help of Leishman stain. Draw the blood smear, then put the stain. How many drops? There is no hard and fast rule, just to cover the blood smear. Then after that, put distilled water. Okay, then you have to wash it away gently, and then you have to dry it, and then and observe the cells under the microscope. Now, more than discussing it theoretically, you have to go to the lab and perform it yourself. Then you will automatically learn. Those who are new, I am still telling there is nothing to worry. Not much has been discussed till now. Okay, so drawing the smear, only those who joined earlier have done this once. Okay, so those of you who are new, you should draw the smear, and today's class is on how to identify the cells under the smear. That is, most of the cells, what do you expect? This knowledge you all have. What are the most abundant cells in the blood? Red blood cells or erythrocytes. So huge in number. It is in, we express it theoretically in the number per millimeter cube of blood, or the same thing is in microliter. In CGS system, the unit is millimeter cube. In SI system, it is microliter. Okay. So per microliter, millimeter cube and microliter is the same thing. We can derive it also. We know this, and from it can be derived, because microliter is 10 to the power minus 6 of this liter. So we can derive that one from this. It can be derived that 1 microliter and 1 millimeter cube are the same thing. So we in different textbooks and wherever you find blood counts, you will find it is written either per cubic millimeter, or it is written, it can be even it is written in millimeter cube, means it is written in words also, cubic millimeter, or it is written microliters. So it is microliter, millimeter cube is the same thing. What is the theoretical count we know about RBCs? It is in million, 4.5 to 5.5 millions, whereas our WBCs are only 4,000 to 11,000. That is in per this unit. So from that you can also calculate the total count. So this will be discussed in the hematology theoretical portions. Total count in the, so 5 liters, if you consider 5 liters of blood in the human body, then how many different cells are there, total number of cells. But it is expressed in per microliter. Otherwise, these will be huge figures. It is 4.5 to 5.5 million for RBCs per microliter of blood. It is 4,000 to 11,000 only. That means RBCs are almost 1,000 times in number than WBCs, and platelets is 1.5 to 4.5 lakh, still less. By Leishman staining, what are identifiable are mostly the RBCs and WBCs, also platelets by Leishman staining. The Leishman staining, whatever we are doing here, and you have to know the, again for those who are new, I am just repeating, Leishman stain, you have to know the composition. From the exam point of view, it is asked in the exam, and from the knowledge, for your knowledge also, the different components of the stain the different parts of the cells. Okay, different components. The Leishman stain, the staining components are eosine and methylene blue. Eosine and methylene blue. And the whole thing is called eosinated methylene blue in acetone-free methyl alcohol. You don't need to write anything. I am going a bit fast. These things have already been done. Everything, you follow a physiology practical textbook, everything is written. You try to say eosinated methylene blue in acetone-free methyl alcohol. The methyl alcohol is the base of the solution. It is the acetone, it should be acetone-free. Why? There are reasons. Acetone cremates the cells. Okay, and eosine and methylene blue stains the components. Eosine stains the RBCs, particularly the cytoplasm of the RBC. You should be particular, cytoplasm of the RBCs. Now, why do I mention it? RBCs has no nucleus. You all know it. RBCs have no nucleus. Okay. So it stains the cytoplasm of the RBCs and granules of eosinophils. Here, just a quick discussion. The WBCs are of White blood cells are of two types broadly. We classify them as granulocytes and agranulocytes. Granulocytes will have granulocytes, they will have granules, agranulocytes won't have granules. Granulocytes and agranulocytes, WBCs type. So granulocytes will contain granules. What are the names of the granulocytes? Neutrophil, eosinophil and basophil. We about the WBCs, theoretical parts will be discussed in the theory classes. More about the WBCs, just for whatever you need to know for performing in the practical lab now, that we are discussing in short. So granulocytes will contain granules. Among these, granules of eosinophils are somewhat coarse and they are stained by eosine. Okay, and whatever is left, so in the books you will find it is written that these methylene blue stains these things, eosine stains this is, you just remember this is just, so from the first day try to, that means from the initial days try to make a habit or try to make it up in your mind that books and classes are complementary. Some things, the books will give you the correct information, but the books are writing like this, that eosine stains these things, methylene blue stains these things. Now in the exam you will face questions like this, that which this particular part of this nucleus of this neutrophil is stained by what. So whatever, how do you remember it easily, that eosine stains granules of eosinophils and cytoplasm of RBCs. Rest whatever you find, you go for methylene, right? Nucleus of neutrophil. So nucleus of all WBCs, even the eosinophils. Okay, nucleus of the agranulocytes as well. Agranulocytes don't have granules, they will have a cytoplasm and a nucleus. So nucleus of the lymphocyte, nucleus of monocyte, all are stained by methylene blue. So they will look like dark purple like this under the stain whenever you examine in the microscope. And RBCs, if the staining method is proper, then RBCs will look no, not darkish. RBCs, whichever is stained by eosine, that is pinkish. Okay, so now what you consider is the size of the cells. RBCs are huge in number but smaller in size than WBCs. Neutrophils, eosinophils, basophils, everything will be at least maybe 1 point, and you have to make when you look at under the microscope, this will come by experience. You can't, under the microscope you can't measure. RBCs are 7.5 micrometer in diameter. Neutrophils, eosinophils maybe 12 to 14 micrometer. These things, these cells. Monocytes are the largest of these. Lymphocytes are, according to size, are again classified as small and large. But small lymphocytes may be around the size of the RBCs, more or less. But large lymphocytes might be twice, but you cannot measure as micrometers. It is not possible to measure there. What you will have to do it, RBCs are huge in number in any field. When you look under the microscope, a particular field, RBCs, most cells are RBCs. You have to compare the size of the WBCs to identify the WBCs with the size of the surrounding RBCs. This is the first point, how to identify a particular type of WBC, whether it is a granulocyte or a agranulocyte, whether it is a neutrophil, whether it is a basophil, whether it is a eosinophil, an eosinophil, whether it is a lymphocyte, whether it is a monocyte. For the size you compare with the surrounding RBCs. Sometimes what are the very common mistakes when you are asked, at least from the examination point of view, when you are asked how do you identify this is a lymphocyte, the examiner asks you here you will face after doing the experiment, the examiners will cross you. That means will cross you means verbally ask you that you are telling that this is a lymphocyte. You have focused a lymphocyte under the microscope. How do you stand it? What are your points in favor of it? So don't go for, if you go for an answer like this, it sounds very foolish. What? The size of the lymphocyte is such, it is about whatever you have read in the theoretical you have read in the books. It is about 20 micrometer. Can you measure it under the microscope? No. So you have to tell the size is almost 2 times the size of the RBCs, surrounding RBCs. This is the answer. Don't tell the actual size what we know theoretically. It is not possible to measure it under the over there. So that is how to first point of identifying the WBCs. What is the second point? Now looking at the features, structural features. So the nucleus, do you get it? Okay, so the nucleus The RBCs have no nucleus, but WBCs will have nuclei. These granulocytes usually means have lobe nuclei. So lobe nuclei, neutrophils nuclei are 2 to 7 lobed. Okay, 2 to 7 lobed. It may be 2 lobed, it may be 3 lobes, there may be 4 lobes. Till now we know that nucleus more than 7 lobed have not been seen till now. So 2 to 7 lobed. So it may be 2 lobes, it may be bilobed, it may be trilobed. So 2, 3, 4, 5, 6 or 7. Okay. So you can identify the lobes. They will be stained by methylene blue, and there will be fine granules, which are for on the first day, on the second day for the beginners, maybe fine granules are not very easy to note. Okay, fine granules. But eosinophils will have coarse granules. Now, as soon as you find the eosinophil, compare with a neutrophil. So when you are working under the microscope, just remember how many fields before I have examined the neutrophil. So how to move, you will learn it. It is no point, it is actually no point discussing it theoretically. How to move the using the screws, adjustment screws in the microscope, how to move the slide. When you do it with your own hands, it will be better for you, it will be good for you. It is no point describing it in words. So move the fields, study the different fields. So remember, in this field I have seen one neutrophil. Now compare it with the, for the beginners to learn, it is best to compare it with eosinophil. Eosinophil granules are coarse. But what is the better point to identify eosinophil? It is bilobed and it is said as spectacle shaped nucleus. Classically, it is spoken of as spectacle shaped nucleus. Okay. So bilobed spectacle shaped nucleus, which we will see under the microscope. This is the identifying feature of eosinophil, along with coarse granules which are stained by eosine, so they are pinkish. So now if you see a neutrophil, you can again compare. The granules are finer. So is it easier to fast identify coarse granules or fine granules? Of course, coarse granules. So then compare. Sometimes in the exam, the students, what they are doing, they are saying, I have found a basophil. So I would suggest, and I am saying it on record, don't go for that. Basophils are so less in number. Among 100, we will learn about the differential count. Actually, for your exam, the topic is differential leukocyte count. We are studying it like this. First, we have studied the microscope. Then we are going for studying preparation and staining. Then identification of cells. So step by step, then we are going for differential leukocyte count. It won't be from the examination point of view, won't have a question, just prepare and stain a smear. Question is, the question in the exam is the question, you have to go for differential leukocyte count. So you have to follow these steps and count the cells. So basophils are so less in number, theoretically we know it is, if we count even 100 cells, there may not be a single basophil. If you can actually count 200 also, there may not be, because basophils theoretically it is also done 0 to 1%. That's why, because these are very rare. So at least in the first year of your medical school, better not to comment a cell a basophil, and if you find, then my suggestion is avoid that and count other cells. Okay, basophils are rarely found. So basophils have some features, like these are lobe nucleus, there are some granules, maybe somewhat fine or maybe somewhat coarse, but don't comment on it because basophils are very rare in number. So comment on neutrophil, that this is a neutrophil or this is an eosinophil or this is a lymphocyte, this is a monocyte. Theoretically, lymphocytes, neutrophils will be the most abundant of the WBCs. It is 60 to 65%. Some books are writing 60 to 70%, 65 to 70%. Around 20 to 40% are lymphocytes. So if you count 100 cells, maybe you will get 20, 25, 30 lymphocytes. If you eosinophils are like around 5% like this. Monocytes are still less. Basophils are very rare. But monocytes, although they are less, not like 0 to 1%, somewhat more, but monocytes, if you count 100 cells, you will find at least 3-4 cells you should find monocytes. They are easy to identify. So rounded cells, RBCs are rounded cells with pinkish cytoplasm. At least under the microscope, you appreciate it as with the pinkish cytoplasm. WBCs, rounded cells with the, as I mentioned, the features for the neutrophil and the eosinophils. Now, at this point of time, maybe some of you or most of you are finding it difficult, because as I am speaking, I am visualizing these things. Once you start working with the microscope, you will start visualizing. And for differential leukocyte count, we will keep at least say 1 to 2 weeks. We will go on with this topic. But from the next day onwards, you will work directly in the lab. There is no need for this theoretical discussion. But remember that don't miss classes. That is my suggestion, because you can't be expert in this one experiment on one day only. That's why, that is the cause of the syllabus is structured, and we arrange the classes so that whatever lessons, whatever topics need more time, they are repeated. But after the topic is over, say we spend 2 weeks over it, after this topic is over, it is again difficult for even us to tell when the topic may be revised again. So the syllabus in MBBS is not, all things are not tough, but the syllabus is huge. The course volume is huge. Okay, it is practically, it is 1 year for the first phase, these 3 subjects. This is not practically, sorry, theoretically, but practically it becomes around 9-10 months. Classes will be over by 9-10 months, and there will be internal exams conducted by the institution in between. Those exams, the marks from those exams, average of those will go to the university, asks for it, and the university decides who are eligible. There are eligibility criteria, 40% eligibility criteria. Okay, for theoretical it is separate, for practical it is separate, 40%. And in the final, the eligibility of the finals, these have been discussed during the foundation course. 40% in theory, that means 200 marks you have to appear for theory in the subjects of the first phase. Till now it is the rule. If the university makes any change, you will be informed in due time before the exam if changes are made. So out of 200, 40%, it's 80 is minimum. Out of 100, 40 is minimum. But total subject aggregate, out of 300, you have to get 150. So just make a note of it. 80 out of 200, 40 out of 100. But merely getting 80 and 40, or say 85 and 45 is not sufficient. The adding subject aggregate has to be 50%. Right? This is the, right now what is for the last 3-4 years, this is, after many years a change came, and this was, earlier it was minimum 50% in theoretical separately, minimum 50% in practical separately, practical portion. And obviously if it is minimum 50% in theory, minimum 50% practical, if these two are met, then obviously subject aggregate comes to 50%. So now it is 40%, but if you get 40% in theoretical, then just calculate out of 80 out of 200, then you have to get 70 out of 100 to make it 150. If it is 40 out of 100 in practicals, then the theory minimum comes to 110 to make it 150. So just put it in your heads in the initial part that it is not sufficient to get 40%. So put it in your heads that I have to score at least 50. That means 50% I have to score for passing each subject. Until you pass all the subjects in the first phase, you are not allowed to appear for the subjects which are in the second phase: pharmacology, pathology, microbiology. Okay, we will be discussing again these things in times to come. Frequently we will be discussing these things, so that you are new, so that you can get an idea. Within the first phase, within 6 months, all these will be clear. But the syllabus volume is large, and note for it. So differential leukocyte count, maybe you will be doing this week and the next week. Okay, this week after identification of cells. So those who are in, so the division of the batches have to be very clear. Otherwise, so that you can attend 2 anatomy sessions, 2 physiology sessions, and 2 biochemistry sessions in each 6 days of each week, Monday to Saturday. Okay, so Wednesday's batch again comes for physiology on Saturday. Okay, and we will be doing differential leukocyte count maybe the next week also. But after that, it is difficult to devote time for the same topic. So coming back to the topic proper, that when you count the cells, so neutrophils will be expectedly much more in number than lymphocytes, and they will be again more in number than the basophils and of course basophils don't comment on basophils. Again, my suggestion, don't comment that this is a basophil. Monocytes and lymphocytes. Lymphocytes are very easy to identify among all these cells. Just a rounded cell, and inside the nucleus covers almost the whole of the cell. So just now as I am talking, I am visualizing it, and after seeing it on the first day, you can visualize from the next day onwards. But still, to do it properly, it requires some practice. Okay, so it is a rounded cell, and inside it a rounded nucleus almost covering the whole of the cell. So what happens? Around the nucleus there is cytoplasm, and that is a thin rim just inside the cell membrane. It looks like that, and the nucleus is covering almost the whole of the cell. And lymphocytes, theoretically we know it, some are small, some are large, classified as small. Those who are small lymphocytes around the size of the RBCs more or less, those which are large lymphocytes are much larger, almost twice the size of the RBCs. So like that you can comment, this is a large, this is a small lymphocyte. Other cells are not classified, I mean, size is neutrophil, small, large, nothing like that is there. Neutrophils 1.5 to maybe 1.5 times the cells of the surrounding RBCs. Same for eosinophils and basophils. Again, I repeat, better not to comment any cell as basophil. Neutrophils, so neutrophils, eosinophils. Lymphocytes like this. Monocytes, again easy to identify, much larger cells, maybe 3 times the size of the RBCs, and the nucleus is bean shaped and towards one side of the cell. So the rest of the cell contains you can find the cytoplasm, and they are agranular, no granules. So these are how to identify the WBCs. Bean shaped nucleus, once you see it, you will not forget. Okay, once you see it once. Again, what I am repeating is that as I am speaking, I am visualizing. Once you see it, you can visualize it. So first time only for this class, those who are present, you are finding it difficult. You have not looked at it under the microscope. Once you have seen one monocyte, you will know how typical it looks. Bean shaped nucleus towards the one center of the cell, it will be purple colored because stained by methylene blue. What I told, what did I say? Anything except cytoplasm of RBCs and granules of eosinophils stained by methylene blue. And now there are some theoretical aspects to discuss. There is no point discussing this. They are so not very tough things. Discussing this, and they can be discussed if there is a scope. They can be discussed in the theoretical classes. Theoretical things, you follow any practical textbook, any physiology practical textbook, you will find these things. What I recommend, I go on repeating, I recommend the book by Dr. A.K. Jain, but that is not any hard and fast rule. Just you have to learn the topic. There are so many books available in the market. For practical physiology, I recommend the book by A.K. Jain. I have found it suitable for the beginners. It is a colorful book, lucidly written, but there is no hard and fast rule. You have to follow that book. Whatever book you have to follow one practical physiology practical textbook, that is recommended. Without a book, it will be difficult because you have to read from the book, and I'll ask you to carry the books to these practical books. Theoretical books, of course, not required, but practical textbooks you carry to the class. Whenever you find any problem, when you are performing, if there is any problem, refer to the books. So please purchase one physiology practical textbook for the practical classes as well. When you go home from the classes and study, it will help you. And in the practical books itself, questions and answers are, most authors are giving questions and answers at the end of each topic. So in my opinion, again in my opinion, the best one, very extensively written questions and answers, very nice textbook, so nice book, practical textbook, that many aspects of theoretical physiology, theoretical aspects are also covered. That is the book by Dr. C.L. Ghai. Okay, but as beginners, I would suggest you go for the book by Dr. A.K. Jain. Once you are 1 or 2 months into the course, you just take the references from the library. Or these days, it is in our times when we studied, these facilities were not there, smartphones and all. You can just download the PDF. Current editions are not available usually. PDFs of current editions not available. 1 edition back, 2 editions back suffice. See the book by C.L. Ghai, or that is a very good book. Again, these opinions will vary across faculties, across students. Some students prefer one book, some students prefer another book. In this part of the Bengal, I may say in this part of India, usually most follow for physiology the book by Dr. Devashish Pramanik. I am saying it on record. But there is no hard and fast rule. You have to know the topic, you have to gain the knowledge, pass the exam, gain the knowledge. These are basic subjects. Anatomy, physiology, biochemistry, these will help you to, after this you will study about pathology, microbiology, pharmacology, and these are the foundations of the clinical subjects: medicine, surgery, gynae and obstetrics, pediatrics. So these are the foundations. So you have to gain the knowledge to have an understanding. So that is your purpose. Books are according to your own opinion, whatever you find suitable in this part of the world, that book is followed, but that does not mean that is mandatory. So whatever I am saying about books, with this book you have to follow, that is not mandatory, just that is my suggestion, right? The book by Dr. A.K. Jain. So any book you have, so this topic from the next class, try to carry the books, so that after a few days just get settled, carry the books, so that it will help you during performance of the experiment. This is just hematology sessions. After this, not after this, along with we will have clinical sessions. So physiology practical is hematology sessions. In the exam you will get it for 10 marks. Clinical physiology and human physiology for say 20 marks. Okay. So the other sections are there. Amphibian physiology I have discussed in 1 or 2 days, but again you can know about them. Hematology, there are so many topics. So the first topic is differential leukocyte count, the steps of which are staining, preparation of the blood smear and staining, and then identification of the cells under the microscope, and then going from the counts proper, and the rest of the topics will follow, like total count of RBCs, total count of WBCs. So these are blood grouping, determination of blood groups, estimation of bleeding time, clotting time. You will know subsequently. Okay, when you will get time. Today it's we are a bit late. It's 12:20, so you'll get say 40-45 minutes. You just learn, those who are new, learn to draw the smear. The technician will be there, the laboratory technician will help you. Just learn to draw the smear and make batches of 3 or 4. Learn to draw the smear and examine under the microscope. The blood on a filter paper, we will study about it. So that is, capillary blood is mandatory. So we always recommend working with capillary blood, and from the first day you learn how to prick. Take those who have already done, help them, take our help. Okay, take the help of the lab technician. So you have to put the blood drop on one side of the slide. So if it is the slide where we are taking the blood drop, so from the finger the blood drop is to be transferred one or two drops over here. So not in the middle. So then put the other slide in front of the blood drop, not exactly on it, because directly putting it on it may make it irregular. So just put it in front. Now gently draw it behind. This is the way. If here is the blood drop, now the blood smear will be this. After this it will be this. After this it will lessen, and this smear will be like this, and it looks like a tongue. Okay, so it is called a tongue shaped smear. So this is the way. And before pricking, what are the precautions to be followed? Those who had joined earlier, they know. I think they should know by now. That is, you have to dry with spirit and cotton. Okay, dry the rub the finger with spirit and cotton and dry it. Why to dry the spirit? Otherwise, when you prick, the blood may get mixed with the spirit. This, if you take even 1 or 2 drops of blood, that should be fully, it should be blood. If it is mixed with spirit, then number of cell counts will lessen. So if blood diluted with any other fluid will not give good results. And another thing is that drying is required, because it takes some time to dry. It may be 30 seconds, 45 seconds, 1 minute. It takes some time to dry. That time is required for the disinfection action to occur. So whenever you are asked, or whenever you have to answer that why this drying required, because one purpose is that this anti-disinfecting action of spirit takes some time. Maybe it is several seconds, 30 seconds to 1 minute, and this disinfecting action takes some time, and by the time it dries up, the disinfecting action comes. And the second reason is blood should not get mixed with the whatever liquid we are using, whatever disinfectant liquid we are using. Okay, So these are the reasons for drying it. After drying, you have to make a single deep prick. Okay, people who are there on Saturday, they have already done, I think, but many are new, so there should be a single deep prick, so that the blood freely. The idea is so that the blood freely flows out. If you have not done it earlier anywhere, then you will be anxious, and if the prick is not deep, then what will happen? Then you will find yourself, it is our reflex, an automatic reflex like this, that you will try to squeeze out blood. What happens again? Tissue fluid. We'll read about tissue fluids in general physiology. Tissue fluid means fluid interspersed between the cells in the tissue spaces. It is also called interstitial fluid. That will get mixed with blood. Again, the result is same if blood is mixed with those spirit and all. If it is not blood, how will you find cells? It has to be blood there. It should not be tissue fluid. So if you squeeze like this, what will mostly come out is maybe very small amount of blood, but mostly it will be tissue fluid. It will not suffice your purpose. So you will have to make a prick and